Hello, my name is Jane Hartley, and I am the Director of Housing and Social Services for the City of Kingston. And I'm happy to be here to talk to you about the housing continuum and affordable housing in the City of Kingston.
Hi, City of Kingston podcast listeners. Welcome back to Tell Me More, our podcast that introduces you to the people who are shaping the programs and policies that make our city a great place to live. I'm your host, Jen Penarski. Kingston, like cities across the country, is in a housing and affordability crisis that is compounded by insufficient addiction and mental health supports. These realities continue to put strain on the emergency shelter, transitional, and supportive housing systems. These systems are part of something called the housing continuum, a conceptual framework that spans everything from emergency shelters to market housing. And to help us understand how the continuum guides programs and supports in the community, Jane Hartley, Director of Housing and Social Services, joins us in the first of a series of conversations about municipal housing initiatives. In today's conversation, she breaks down what this continuum looks like in Kingston, why movement along it isn't always linear, and how the city is working with other levels of government and local agency partners to support people at every stage. We'll also explore innovative programs like the Coordinated Access Priority Pilot, rent supplements, and portable housing benefits, all designed to help people not just find housing, but keep it. Whether you're an agency, partner, a housing advocate, or someone who simply cares about the future of Kingston, this episode offers a thoughtful look at how we can build a more inclusive and supportive community, one home at a time.
So, Jane, the two of us, we're familiar with the housing continuum, but for someone who is unfamiliar with the continuum, how would you best define it or describe it?
Yeah, it's really, if you think about a line, it illustrates a variety of housing and homelessness services, options that are available. There's usually what's considered about seven that are on this continuum, and I can speak to a few of them to give an idea. It's conceptual, and there's about several stages, starting from really emergency services, and that's to help people that are homeless or at risk of being homeless. Then, hopefully, moving along the continuum, we can help people to move from shelter services into transitional housing, where there's that ability for somebody to receive supports and life skills, and somebody help them with their housing search to help them move into rental housing.
The continuum doesn't always move in a linear fashion, that people might start at one point of the continuum and move forward and backwards. But the goal is that we're always trying to move them forward along the continuum into stable housing, whether that's market housing or affordable housing. Is that correct?
Yeah, absolutely. Across the city, there's a number of different types of housing, and people fit from really emergency housing response, emergency shelters, right through to market housing where people have ownership. And it isn't a linear process. If you think about life in general, people have situations that change their life. The landscape changes, economic changes, medical changes. So people move up across the continuum, hopefully, like you say, moving forward, but at times may have a need to move back, maybe to rental, or something happens and they need to, affordable home ownership is no longer possible, so they have to move into a rental situation. So it definitely is not a linear. Our hope is to keep people progressing forward. And that's what we're here to do with the offering of a number of different types of housing options and supports and services. But you're right. It's people are people, and we have different things and circumstances that change our lives and take us in directions that we may not always anticipate.
I like that you described it, even though this is audio and we're kind of like drawing lines with our hand, but that if you were to look at it online or on paper, it is a line, but it really is a spectrum, and people can spend different lengths of time depending on their life circumstances.
Sometimes people in transitional housing, they need a period of about 18 months. And people sometimes need more than that. They need more time. So in that case, they may need to move into what's called supportive housing. And these are both kind of lower income type housing. Generally, supportive housing and transitional housing, there is some rental charges, but it's based on what a person's income is. It's usually not more than 30% of their income. Once they're able to stabilize there, the goal is really to help move people into rent geared to income housing. And that's the goal, is to help people that are lower income, struggling with mental health, addictions issue, to either be in supportive housing long term or in RGI rental housing. Sometimes it's really challenging. We're in a period of unaffordability, high rent, housing costs. And really, it's about helping people through a home ownership program to help support them move into the home ownership realm. We even also have opportunities for people that are in their home ownership but are struggling because the costs are so high. Mortgage and interest rates are changing. So they can look at accessing the second residential unit grant to be able to earn some extra income through having a laneway unit, a lower basement unit, a number of different options to help increase their income. Yeah, and accessing the services that are best suited to support them during that time in their life. When you think of somebody that is homeless or precariously housed, they may think of those challenges. If you don't have a place that you can call home, you don't have a place where your things are. You don't have a place where, you can access meals or make meals. So that's when the emergency services, shelter services come into play. The city supports people that are precariously housed or homeless they need to store. So there's storage options because they don't have somewhere when they go into a shelter. Within the shelter, there's really a number of opportunities to engage with outreach services, housing first workers, to help them find a affordable housing or to find the pathway to apply to get on the centralized waiting list while they're waiting for a place, and then they can help them look for some affordable rental housing as well. There's also prevention diversion services. There's just a number of different services, and prevention diversion services it's an opportunity where somebody, it's really it's getting into a rental place, first and last month's rent, like those type of things that is the barrier to somebody moving. So there's an opportunity to access those funds. So it's really at that period of time to help support the person access the services they need, talk to somebody that can help kind of navigate the complicated system. It can even be something as simple as, identification. You can't rent a place without identification. So it's just really, we meet the person where they're at, the staff, and through our partner agencies who we could not do this alone. We need that support of our valuable agency partners to meet the people where they're at and to see what their needs are and to help navigate them towards needs. Ideally, we want people to come into the shelters, access the service there. And then from there, we can move on into that transitional housing, into the supportive housing that's run through our partner agencies who are the experts on the ground, many understanding lived experience and how best to support people that are facing really complicated, complex challenges, such as poverty, addictions, mental health challenges. Those are really hard challenges to manage on top of trying to just find and to keep a roof over your head. So we're happy that we have fantastic partners to work with, great staff team that we can work with, and trying to help people stabilize their lives and move forward on the continuum into that rental housing, RGI, or, supporting employment, finding employment, and being able to access private rental as well.
You've talked about a lot of different pieces or components that go into moving someone further along in the continuum into supportive community affordable housing, eventually market housing. But I want to learn a little bit more about that far end of the spectrum for someone who is experiencing homelessness or precariously housed. Like, what does that look like in Kingston?
Great question. And it really is, it's like the three legs of a stool. We need all legs to be able to help and effectively help and support people that are the most vulnerable. These are people that are most in need. And really it starts with, there's a number of different partners that make this happen. As you mentioned, we're agency partners. And some of those key ones are home-based housing, Lionhearts, the Salvation Army, the United Way, who is a key supporter of reaching home funding and supporting different initiatives in partnership with the city. There's also, of course, our senior government funding. We do receive provincial funding and federal funding to support the most vulnerable. It's not enough. And, we're always advocating for long-term sustainable funding so that we're able to know with predictability the funding that we have to ensure that we can address the needs of our vulnerable homeless and at risk of homeless, but also to develop and create enough, the sufficient, supportive, transitional, and affordable housing. In Kingston, like other communities, the need for housing is high, and the need for emergency services and the supports to help bring people inside and to help move them to navigate towards rent geared to income or private market rental is high. Currently, we have about 1,650 on our centralized wait list here in the city of Kingston, County of Frontenac. And the wait list is people apply for rent geared to income housing. So what we do is we work with, and our partner agencies work with people that we can encourage to come into the shelters to apply for housing there. It's also access through a number of other avenues. It's access through our partner agencies. You can access it by coming to 362 Montreal Road to the Housing and Social Services office. So there's a really variety of ways that you can request the need for housing and say that you'd like to come on the housing wait list, and then you select the building and the location that you would prefer to reside in. There is a wait, and it's much the same as other areas of Ontario. The demand for one bedrooms is high, and the demand for larger units is high. But that helps us by having that understanding of what the need is, so that when we are working with nonprofit housing developers or private developers of this is the need that we have, these are the types of units that we require in this location of this size and price. So it gives us that barometer and indicator keeps us knowing what we need to accomplish and how we need to help move people forward and how many units that we require.
I think that speaks a lot to the complexity of how the housing system works, and that it's not just you go on a list or, that you come inside into shelter
Yeah.
and you get on a list and then you just move along the continuum, that it's far more complex than that.
Yeah.
So along that continuum, where do we experience the most pressure, or where would someone who's seeking shelter or seeking housing, where would they see that pressure sit in perhaps being on that wait list?
Yeah, and that's likely because often when you go on a wait list, you hope that you don't have to wait a long time. And unfortunately, a social housing wait list, there is a wait time. So what has to happen in the meantime is really trying to support a person and that's where our partner agencies are great at. They have what's called housing first workers. And those workers will work specifically with an individual to support them in their search for private market rental. Also, if they may be eligible for transitional housing or supportive housing based on what their needs are. If they're dealing with addictions, mental health, what supports they need, that could be the avenue that's looked at for them. And and also just to people think of somebody that's homeless as somebody that you see on the street. That's the most visible types of homeless. But homeless comes in many different varieties. People that are just residing with a friend, that are couch surfing, that are homeless for a short period of time and then find a place and then are back into homelessness. It's really, homelessness encompasses a variety of people that are just vulnerable. Their housing is very vulnerable and it's precarious. And we're talking not just single individuals, we're talking sole support parents, there's seniors that are in the emergency shelter and in the homeless system. So demographics, it's really everyone. It's newcomers. It's just homelessness can touch everybody. That's why we say understanding where people and meeting them where they're at is really important, because then understanding how they came to where they are and what are the barriers that are keeping them from coming inside and from accessing support. Often it's trauma, often it's mental health, addictions. There's always a reason for that, and it takes time, relationship building, and that's what we do with our agencies to work with individuals that are at the far end of the continuum in the emergency housing response area that are with homelessness or emergency shelters and try to move them along. And I think to the comment, the question around where is the pressure sometimes is we do bring people into transitional housing, or they come into transitional housing. And then it's about trying to help them find a place within that 18-month window when they're ready and able to move and live independently. But it's about finding an opportunity for them, a housing solution. And I'm really happy to say the City of Kingston has found ways. We're in the process of a pilot called the Coordinated Access Priority Pilot. And what that is, I mentioned the wait list. And on the wait list, there's priorities you can have in place. The one that we do have is for survivors of domestic violence and human trafficking. So they're automatically at the top of the list. But the city, and that's a provincial priority, every municipality in Ontario has that priority. The city can then create priorities that are needed based on their housing need. And one is the coordinated access priority. And what that is, we recognize we have people that are in transitional housing, have been there beyond the 18 months, and they're able and willing and ready to move on. And it's a bit of a bottleneck there. So what we've done is we are working with Kingston Frontenac Housing Corporation, our largest nonprofit housing provider, who is freeing up when they have a vacancy, that we're able to move somebody that's been identified by the staff at the transitional housing, so one of our agencies, that is able to move. So they will support them to move into that unit, provide supports around them for up to a year to make sure moving is traumatic for somebody that's been not in taking care of bills, cooking their meals, not doing those things. So that support's there. And then the benefit of that is it frees up a space for somebody in a shelter that's also ready to transition and come in for that 18-month stabilization. So if you think about it, it helps to move people through the continuum, which is very important. You need that flow, but you also need the availability of supply and stock to allow that to happen.
And through those additional programs, supporting people or programs and opportunities for second residential units, that income can also help people stay in their homes longer if that's something that they weren't previously able to afford to do.
Yeah. And there's so many programs. There's another that's called Kingston Renovates. And that's a program that provides a forgivable grant to homeowners that have major capital repairs, accessibility requirements. Just to your point, Jen, that really it's more beneficial if we can keep people housed where they currently are, close to their family, close to their supports, rather than have them move into a unit that's rent geared to income. Rent geared to income units are definitely needed for those that need that deeper level of affordability. But for some people, just that helping them fix that critical repair, like their roof or something that they're not able to afford on their own. And also to that point, like there's also portable housing benefits. Again, why have somebody move when all they need is a shallow subsidy because their income is such that they're just not able to cover the rent at that amount? So an opportunity to say, hey, you know what? Bridging that gap of like $200 helps them stay in their private market rental so they don't need to move into a rent geared to income unit. And that unit can be freed up for somebody that needs that deeper subsidy. So it's really about looking, like we say, meeting the person where they're at, understanding what their need is, and then trying to leverage the best solution, in an environment where we have many that need housing, and looking at how best to support everyone.
The coordinated access priority pilot, when
Mhm.
does that start?
It is starting in May, starting this month. Our plan is to run it for 1 year. The reason we want to do it for a year before we roll it out, and do it specifically with Kingston Frontenac, before we roll it out to we have 15 housing providers with the City of Kingston and the County of Frontenac, is to evaluate, make sure it's working well. What are the challenges? The key here is you want this to be a success story for both the person that's moving into the unit as well as the landlord. So we want to make sure we're connecting with the person moving in, the new resident, after they've been there for a while, how things are going, any challenges, their support service worker that's supporting them through this, as well as the landlord. And then we can learn best practices, lessons learned, and then before we roll it out. So it's a bit of a cautious, but a very important way to move this forward. A piece of it will not just be with our housing providers, but we do have arrangements with private landlords. We enter into what's called a rent supplement agreement, where we will pay the landlord the difference between what their tenant would be required to pay, when I talked about the 30% of income, up to what their rent is, their market rent. And those are also individuals, landlords, that we would like to have support our people moving from transitional housing. It's a nice way to do that because our rent supplement landlords are scattered across the city, county, whereas social housing is in different, kind of in, various locations. Scattered units with rent supplement units is across. So you really see the economic, social integration happen there as well. So it's sometimes that's a real benefit for people to move into. It could be closer to where their neighborhood was before, so there's opportunities for coordination and alignment of supports and services.
I think just you describing this program and the pilot is a great way to wrap this part of the conversation, because it
Mhm.
goes back to what you were saying about that sense of place and that sense of home where somebody can bring their things and have a sense of safety and that social inclusion as well. My understanding, or maybe this is maybe not, it's just helping meeting people where they're at. If they're in a community where they are welcome and supported, that's like a big part of healing that trauma and sort of moving people forward.
Mhm.
Is that somewhat
Yeah.
close?
Yeah. Well, to me, really, housing, having a roof over your head is the backbone. Like, so when somebody I've seen people when they first come into their unit and say, "This is the first time I've had a home in 3 years." That is so, when you think about that statement, that it's powerful. And these are people in tears because they haven't had anywhere to have their things. Their things might be all over the place, or it could have gone missing, or they've had to move so many times and flee domestic violence, or there's so many different circumstances. But once you have a place that you can call home, you're right. That's when you start to see the healing start, because connection with services, having an address to say, here's where I'm living, having the ability to hang a picture on the wall, to cook your own meal, to do those things, cook a meal for your family might be something that we take for granted. But for somebody that's been living precariously, it's like you can't even describe it. To me, housing is the backbone. It's a human right. It's part of our national housing strategy as a right for. So we are really, our goal is we're try to work towards helping and supporting those that are at the far end of the continuum, to help support them to come inside, because really coming inside is the first step towards us being able, and our partners being able, to support you, and then right through to home ownership, because we assume with the challenging things, the way things are now, people need support when they're paying their mortgage with that. So if there's maybe putting on a residential additional unit or something to help young families or those people that have retired to supplement their income and help provide housing for somebody that needs that housing desperately. So it's a win-win really across the continuum where we can find opportunities to encourage and support and develop programs that can put people into units and housing solutions.
What is something about the Housing and Social Services team that you would like people to know?
That truly they are a dedicated, compassionate, empathetic team. I see that every day. I see it in the interactions of staff working one-on-one with people that come into the office, people that are facing really challenging situations. And they in the office, outside, in different locations, they're there to help. They go above and beyond. I've seen staff take that extra step just to spend time with a person and explain it and following up, which is so important because really you just want to know that you've been heard and that if somebody is saying they will provide something, that they follow up on that. And that's really important. And people come into this business or into this field, really you want to bring about change. You want to help people. That's your passion. That's your goal. And I really do see that every day in the staff that I work with, the staff team I have, and also across our partner agencies. And the integration of the staff with our partner agencies is just really something wonderful to see because, like they say, it takes a village. And that's what we work towards, is trying to make sure we really understand what the needs are and how best we can help.
Thank you for listening to today's episode. If you're looking for information about any of the programs we talked about, check out the show notes for links and resources. Home Base Housing's Street Outreach Team monitors homeless individuals. If you're homeless or know someone in need, please call 613-542-6672, extension 130. If you or someone you know is in a crisis, please reach out to Addictions and Mental Health, KFLA 24/7 Crisis Line at 1-866-616-6005.